My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Today on the Expect Miracles podcast, we have Dr. Rachae Bell. Dr. Rachae is an amazing Blair Upper Cervical chiropractor out of Spokane, Washington. She has an amazing life story. She is extremely passionate about upper cervical chiropractic. She loves what she does and gets phenomenal results in her practice. Today on the podcast, Dr. Rachae will be explaining the importance of the CranioCervical Junction, which is arguably the most important area to our overall well-being and health because it is the gateway communication center that connects the brain and the spinal cord. Every function in our entire body is based on the integrity of this area. Today, Dr. Rachae explains the importance of this area, how to keep it neurologically clear and functioning to your optimal potential. Please welcome Dr. Rachae Bell. Dr. Rachae, how are you?
Wonderful. Thank you. Thanks for having me.
Thank you so much for coming on. I know you have a very amazing story of how you got into upper cervical chiropractic, and you are doing amazing work out in Washington, and I hear you're opening up a second practice, which is very exciting.
We are.
So, Dr. Rachae, before we get into that, where are you from originally?
I am from a little town called Davenport, not Davenport, Iowa.
All right, I was just about to say.
In the chiropractic world. I never ran into that problem until I had fellow chiropractors as friends. So it's actually a small town right outside of Spokane. There was about 2,500 people and I graduated with 22 students. So tiny, tiny little town just outside of Spokane, which Spokane is where I practice now.
Beautiful. And you were just going over how that is much different than Seattle and what people think of Washington, right?
Yes, we do not get the 24/7 jury sky unless it's summertime. We have much more drastic climate changes and lots of trees and rivers and lakes. We have beautiful summers. It gets hot and cold winters and snow so we can go skiing and snowmobiling and things. So lots of stuff to do
beautiful.
Here.
And Dr. Rachae, what were you into growing up?
I played a lot of sports. I sang. I was a lead in a musical.
Wow.
I was in jazz choir. I played volleyball, basketball, softball, and my summer jobs, I worked on the farm. So I was a farmhand and did tractor driving and combine driving. We harvest wheat in our area, so wheat and barley. So I was a farmhand and worked on all the equipment and kept the farm going and loved it.
So you were probably no stranger to some injuries and pain growing up with all that. Were you always under chiropractic care, or was that something you found later on in life?
It is a funny story because I had never been under chiropractic care until I went to school.
Wow.
So I have a very unique kind of way of getting to chiropractic.
Let's hear it.
I first knew that I was interested in health and wellness or the body from a young age. I mean, I wanted to help people get better. And then I had an injury in softball. Funny enough, I really did not have many injuries. This was the one and only time I actually had to go to the doctor for an injury.
Wow.
In sports and all my things that I did. And I rolled my ankle. The primary doc in our small town said it'll take probably 6 months to get better. And we had playoffs in 3 weeks.
Yep.
And I said, this can't take 6 months. I got to play playoffs. So my parents took me to a specialist up in Spokane, which had more resources, right?
Mm-hmm.
And they got me back in 3 weeks. And I was able to play in playoffs. So
what were they doing?
I thought, what was that?
What were they doing? So from how did they get you from 6 months down to 3 weeks? Were they doing physical therapy?
Well, the primary doctor just wanted to put me in crutches, immobilize, wait till the swelling went down for 4 to 6 weeks. Then they wanted to put me in a boot and then start physical therapy after 4 to 6 weeks in a boot, right? So the specialist put me right in a boot, didn't ever put me on crutches, had me on it and pressure on it immediately. and just facilitated my body's healing, right? And it was still pretty swollen and sore. I mean, I could not do dorsal or plantar flexion. I was running the bases with a limp because my ankle was so
pushing through
up.
it. Yeah.
Yep. But I was able to do it.
Beautiful.
And the specialist said, you're not going to hurt it. It's not going to make it worse by you being active on it, where the primary doc said you need to not be on it at all, to let this heal. So different approaches, and it worked, and had any ankle problems since. So that was cool. In my head, I thought, man, if I can get people back to doing what they love faster,
yes,
that is cool, right?
Mm-hmm.
And so sports medicine, I was in sports, loved sports, played sports in college, played volleyball and basketball, headed down the sports medicine route. I did pre-med in undergrad, was an athletic trainer for my student job, work study. So I was always in that sports, helping
that
people,
realm,
taking, injury type of world. And I loved it. And then I had a class that was called basically hospital observation. So I had to go into the hospitals and observe several different specialties within the hospital setting. So I observed in the ER, I observed in oncology, I observed in pediatric oncology, which broke my heart. I observed in just general practice. And I thought at that point, before I had observed, that I wanted to actually specialize in knees and ankles as an orthopedic surgeon.
Makes sense.
So the surgical side really excited me, and I thought that was really cool. So after observing in the hospital setting, and I observed in the OR, I just came home, and my roommate at the time, I was having a discussion and said, I like the hospital setting. I really want to help people, and I think I really like surgery, but when I go, none of these things are really exciting me. Like, it doesn't feel like a passion.
Right.
A lot of these people seem overworked. I mean, they might get paid great and have a great income, but they work interesting odd hours. It seems like a lot of their relationships at home are failing.
Yeah.
This break room drama, hearing their personal stories, and they didn't seem very healthy. And I just thought, do I really want to live this way? And I was having this conversation with my roommate at the time, and she goes, well, I don't know why you'd want to work in a hospital anyways. When's the last time you set foot in one? Yeah. She goes, you avoid those things like the plague. It was kind of the first, which seems odd, but it was the first time I thought, yeah, you're right. When I'm sick, I don't go to the doctor. When I have an injury, I figure out ways to help facilitate my body from healing rather than take medication. And so she goes, your lifestyle and how you live is much more in line with the chiropractic lifestyle. And I said, what in the heck are you talking about?
Yeah, absolutely.
When I thought back, I remember my dad going to a chiropractor, and I would go with my friend's mom and sit in the waiting room. And so I was aware of chiropractic, but I had no idea what it was.
Right.
So she goes, you would be an awesome chiropractor. And I laughed at her and said, chiropractic. Right?
Yeah.
Scientific, double-blind studies, scientific method. I mean, this is the medical research model, right? And to me, chiropractic was a little, I wasn't sure about it. But I didn't know, and I thought it was limited to neck and back pain, and I didn't necessarily want to live in a pain world. And anyways, long story short, it took her 6 months. She finally drugged me to the practice that she
kept pushing it.
She kept pushing it.
Wow.
And she drugged me to the practice. It was 2 young guys in the Boise area who had just opened a practice. When I went in, the vibe just felt right. It was, people were happy to be there. They were energetic. I read their testimonial book that they had in their waiting room, and it's multiple sclerosis, anxiety, depression, acid reflux, all these things that I had no idea chiropractic could help with. So then it made me go, I need to learn a little bit more about this. I don't know enough about it to really make a good decision. And so it was weird. Timing wise, Life West did a booth at one of our job fairs. So I sat and talked to the gal. Yeah, she was on campus. I went to school at the University of Redlands, which is in Southern California. So she sat down and she talked to me all about chiropractic and health and wellness and body's ability to heal and the philosophy, science, and art. And she just totally sold me. So I applied, got accepted, and still didn't think I'd like chiropractic. So I actually got my teaching credential at the University of Redlands prior to going to chiropractic school. because I thought I'd show up and say, this sucks.
Yeah.
I don't know what I got myself into.
Yeah.
I better have a backup so I can go home and teach or do something
Definitely,
else.
yeah.
So first I landed there, dove in, love Life West. My first class, my first day was a philosophy class. It was just like, boom, this is where I'm meant to be. And I loved it. The power of the body to heal itself.
This is all very amazing to me too, because there still hasn't been an adjustment yet and you're all fired up about it, which is great.
Right.
Yeah.
Yep. Yeah. So let me back up just a month or so. Before I went to chiropractic school, I should say, is when I got, just before, I was already accepted, headed, but I was working at a chiropractic clinic because the chiropractor who my dad went to and my friends, where I sat in the waiting room, that first experience, he is the one who wrote me a letter of recommendation to get into Life West, because you're supposed to have a chiropractor refer you.
Right.
You know?
Yeah,
so
makes
I said,
sense.
hey,
Yeah.
small towns. I knew him. Dr. Schultz, can you send me a referral? Oh, sure. And so his front desk gal needed to go on maternity leave to have her baby for 3 months. And it would just so happen to be the right time.
Wow.
I could do those 3 months right before I went to school.
Perfect.
So I'm about a month into my job. And I said, hey, Dr. Schultz, can you run me through a new patient exam? Because patients are calling and asking me about what happens. And I have no idea because you haven't taken me through it. And I don't know what you do back there.
Yeah.
So he's taken me through the exam. Oh, have you ever been to a chiropractor? I say, no. You ever been adjusted? No. He looks at me and his jaw drops. Like, are you kidding me?
Yeah.
You're going to chiropractic school. You're working in a chiropractic clinic and you've never been adjusted. This is crazy nonsense. So he started me under care. And at that point, I had no idea there was different techniques within chiropractic. My wheels really started turning at that point about objective measures coming from the science pre-med background. I was interested because I didn't have any symptoms, right? I didn't have any aches or pains. I was a healthy person, didn't have issues with sleep, digestion, all was good. And he was adjusting me and I was like, well, how do you know I need an adjustment? How do you know, I don't feel like I need an adjustment. What do you do after to tell that it actually did something? Because I wouldn't really feel any different either. So that's what got my wheels turning about the objective measures and what do you measure before the adjustment and after the adjustment to determine if somebody needs a correction or if they're holding. Was there a time where I come in and I don't need an adjustment?
Absolutely.
And this was just honest outside thinking. I had no predisposition of chiropractic.
And there's so many people that feel the same way as you, where they're really not walking around in so much pain. Why would I even go see a chiropractor if I'm feeling okay?
Exactly.
Yeah.
So that's where the philosophy class, that first day, where it just totally made sense to me about the body's ability to heal, making sure there's no interference, the communication between the brain and the body, right? I mean, that's health and wellness. That's true functioning at your 100%. And that makes sense to me. And if you're functioning already at your 100%, you don't want to interfere with that.
Absolutely.
Why would you try to fix something that isn't broken? And that makes sense to me.
Yeah.
Yeah.
So where did you go from there?
So finished chiropractic school, was super involved in all different techniques. My main thing was learn everything I can. So
Beautiful.
I did all the different electives. I learned all the different techniques. I kept resonating with pediatrics and upper cervical, but I took some AK classes. I took a network and bio or
BP something.
Yes,
I know what you're talking about.
I know what you're talking about.
Yeah.
It'll come to me later.
Yeah.
I took Thompson drop. I took activator. I took upper cervical classes. I took SOT blocking. I mean, anything I could do, I did to try to understand and be the best chiropractor I could be. And I graduated with clinic honors and student of the year. And I mean, I just took what I was doing really seriously. And in my pediatric classes, I found it really interesting because they always would go back to start with Atlas. In the pediatric courses, they're not necessarily upper cervical specific docs. But when you're dealing with an infant, we know the most vulnerable area of the spine is the CranioCervical Junction, the junction between the head and the neck, right? That's the weakest link. And so if you're starting, for me, the wheels, if you're starting there from an infant, and that's where you're most likely to have an injury, trauma, misalignment from day one, why would that change then as we go into childhood, adulthood, and beyond? So that's where I really, everything just from a neurological perspective, the biomechanical perspective, the biomechanics and the neurology of the upper cervical spine is so complex and so different than any other area of the spine. for me, it made sense that it deserved a special look.
Yeah.
And so that's how I died. I mean, I dove straight into upper cervical. My last quarter, I did some outside training at that time with Dr. Dill. He was our teacher in Philosophy 1, and he super fired me up. He was very polarizing, but I loved it. And some people hated him, some people loved him, but I grabbed on and learned as much as I could and did his coaching program outside. I was doing knee chest technique at the time, knee chest upper cervical. So did a mission trip with their program in El Salvador, which was amazing, and got our hands on so many people and just were able to help, and people just lining up. I mean, it was incredible to serve.
Powerful, yeah.
Community. Yeah. And then after graduation or those last couple quarters, you're thinking, what am I going to do next? And I loved my home. I wanted to move home, and I knew that. So I was planning on opening my own practice, and I headed home and looked at some spaces, and it just felt really daunting.
Upper cervical specific at this point, or just open?
Yep.
Okay, cool.
Yep. At that point, felt pretty married, I should say, to upper cervical. I wasn't necessarily married to a specific upper cervical technique. I had learned some AO, learned some NUCA, learned some Blair, learned toggle, learned knee chest. So I had a good understanding of.
You sound like you're a person that likes to gather all the information and then conclude.
Right.
Yeah.
Do what makes sense for me and my patients and what resonates and feels the most congruent with me, right? So at that time, Michelle Arrieta and Lauren Klum, doctors, were business teachers. So they were helping us set up a business plan, and it was actually the inaugural WAVE event that Dr. Kelly started. I was there at the end of Dr. Klum's term at Life West. I was the first class to graduate with Dr. Brian Kelly, and he started the WAVE, and that year was the first WAVE, and Michelle Arrieta said, hey, you're from Washington State. Did you know that Darren White, who practices Blair Upper Cervical, has an associate position available? And I said, I didn't. And she said, did you know that he's going to be at the WAVE?
Wow.
I said, no, I didn't. So
nudge, nudge. Yeah, there you go.
There you go. Yep. So she made that connection, and it was a perfect match. I didn't necessarily want it to be in Seattle, but Dr. White had a system in place for me to get home. And it was a very clear, you got to reach this benchmark, then this benchmark, then I'll help you open a practice. And once it's up and running and you reach this mark, then you can buy the practice. And that's what I did.
Beautiful.
And so I spent 9 months as an associate. I had been specifically knee chest mostly trained. So that's what I was thinking I would practice. So I said, hey, Darren, you think I could practice knee chest? And he laughed at me and said, how the heck am I going to teach you anything when I don't know anything about knee chest? He goes, just practice Blair, you'll love it. And it turns out I did. I mean, I loved it even more than the knee chest technique. The torque, the analysis, the protractive use. I mean, it was just, I loved it. So I did an associateship with him in his practice in Kirkland and Redmond. And for about 9 months, hit all my goals. Usually it takes 2 years to get to the level, but I wanted to be home. And I was like, I'm not wasting any more time. I'm nose to the grindstone. I am just going to pound pavement. And so we opened a practice in Spokane together. He opened the practice, and then I bought it from him 2 years later. And we're going on 6 years. July 22nd is when we opened 6 years ago. This year is our 6-year anniversary in about a month, just shy of a month.
Well, so congratulations. That sounds amazing. Yeah. Opening up a practice is tough work. It is tough. Yeah.
It is. And what I love, and I encourage 100% students to find somebody to work with and collaborate with. I know that we are all like-minded people. I mean, we have a vision of what we want to do and how we want to do it. But when you graduate and you can focus on just chiropractic and learning your technique and honing in on your craft, and you can just learn how to get new clients in the door, adjust them, take care of them, see them however many visits you think, that clinical decision making, when you also have to do the bookkeeping and the billing and the front desk, right? And the taxes, and you're trying to make
it's overwhelming for sure.
It is so much. And it's okay to do that, but just from my perspective, my learning curve was so far accelerated as a chiropractor and my skill set because I could focus on patients.
Absolutely.
Underneath the wing of a mentor. who
Absolutely.
is taking care of all the backsided stuff. And so I think finding an amazing associateship and being able to grow your practice and not just showing up and like seeing their overflow of clients, like really learn how to build your own practice and get new clients in and develop your skills and be the best chiropractor you can be, I think is invaluable. I think it really, really accelerates your skill level and your understanding. And then you can bite off in the next check. Then you can become clinic director where you're more managing people, you're running team meetings, you're doing a little more of that. And then if you want to become part owner or partnership or buy-in or open a second location, at that point, then you can take on more of the responsibility of the behind the scenes,
absolutely,
payroll, taxes, things like that.
I couldn't agree more, especially because it's such a complex junction working with the upper neck. We most of the time see very complex cases, and coming out of school, that could also be overwhelming. I had Dr. Banich with me. I worked with her for about 8 or 9 months, and just watching her talk to people, watching her just watch the flow, how to run the business. I remember one of my first patients didn't have a posterior arch. What do I do here? It's just like, it's little things that I could literally run, grab her, bring her in. It made me such a better doctor. And just watching from somebody that's really perfected the craft is amazing.
Totally.
Yeah. So, Dr. Rachae, what kind of conditions do you see in your office? I just watched an amazing video you created in your practice where somebody was suffering with debilitating migraines for 25 years and they're completely gone. What kind of conditions do you see in your practice? And I know you guys are getting great results, so I'd love to hear more about it.
Yeah, so I did the Diplomat, which also
nice.
My learning and my understanding of the CranioCervical Junction. Highly recommend. I think it is a must if you want to really accelerate your patient outcomes and just have that rapport even with the patient. And when you know that they have a misalignment, I mean, there is no wavering. There's limitations that matter, right? So we may not be able to help everybody based on what they've got going on, but at least you can tell them what's going on. And then also being able to collaborate with different providers. We can only do so much. If we're clearing patients out, and our objective findings are spot on and the symptoms necessarily aren't changing, what else can we do? We don't have to be everything to everybody. And there are other providers that we can really, really help patients if we have a broader mindset and a more collaborative mindset. So with that being said, symptoms that we see mostly are complex cases. So it's that patient who has been from neurologist they've flown to Mayo Clinic. I mean, they've done everything and everything's fine. Your blood work's fine, your MRIs are fine, your CTs are fine.
Everything, yeah.
So then guess what they have? They have an issue with anxiety and depression. And so they are thinking that it's all in their head. I mean, literally these doctors are telling
and being told it's all in their head.
Being told that you must be making this up. Right?
Yeah.
Like we can't find anything. We don't know what's wrong with you. It must be in your head. So all of my patients then are put on anxiety, depression meds. They're put on sleep aids because they're in pain and they can't sleep and they're thinking about what's wrong with them. And then they're being told that they're going crazy. And so then their mind's racing and they can't sleep. And I mean, to be honest, they are literally like, I just had a new client yesterday. She doesn't leave the house. She's been told, she's bounced around. Everything's fine. I mean, she's a classic patient that we see. And so, her husband brings her in and he's like, even if you just tell us something that you saw something, like that would give us so much peace of mind. And I'm like, well, yeah, look, you're strangling your brainstem pretty much with this amount of rotation and this much tilt and this, and it makes sense to them. They're like, oh, that's why my whole body system's failing. Like my body feels like it's shutting down. And that's because your brain and body aren't communicating with each other.
Yeah.
Right?
And that affects the entire family too. The whole family affected by something like that. Yeah.
She's got little kids. She's like, I can't even be a mom. My husband, I feel terrible. And when you can change those people's lives. So the video that you saw was a patient who actually, I had no idea that she was in this bad of a situation. But she grew up on a farm. They hunt, they fish. So in our neck of the woods, everybody has a rifle or a firearm. I mean, everybody's super responsible. People carry, they open carry. I mean, guns around here necessarily. There's always accidents. I mean, accidents in car wreck. But for the most part, guns are not scary around here. And a lot of times they're just out and about in our living rooms in our trucks and cars, and because that's our lifestyle. Yeah. And so she goes, I never told you this, Dr. Bell, but I had to tell my husband to lock up all of our firearms because I was to the point that I couldn't take it anymore. I was ready to go. Ready to go. And I was tearing up and she was crying, telling me this. And she goes, so this literally saved my life. She doesn't mention that in the video, that specific. I think communicating that's really difficult, especially when you're on film. But you can get the impact of her story and how debilitated she was. And so, my debilitating migraines, people with head trauma, traumatic brain injury, whiplash, really the cases that haven't responded well to anything else, whether it's injections, whether it's medications, whether it's surgery. I mean, one of my patients, they said, oh, it's just TOS. So they just literally sliced his scalenes to open up the TOS. Well, he still has head pressure, headaches, can't turn his head. You know what I mean?
Yeah.
Still has tingling numbness down in the arms, didn't do anything. But now we have limitations of matter.
Absolutely.
Now that those have been sliced, I have a harder time getting him to hold, So it breaks my heart when I wish I could tell a better story so that we could get these people before they do something where we can't reverse it, right?
Absolutely. Dr. Bell, I have a question for you. Why is Upper Cervical helping this people? What is going on where these people are getting their life back and there's no more anxiety, depression, the migraines are going away? How is Upper Cervical able to help with all these conditions?
So I think we have to think bigger than a subluxation or a misalignment than what we think. We think of a misalignment or a subluxation as a vertebra that's out of place, that's affecting nerve flow, and there's lack of motion. And so a lot of the objective of chiropractic is to restore motion to the spine. Proper motion allows for proper nerve input, afferents and efferents, up and down our system. It goes beyond that. When we have misalignments, there's changes in blood flow, there's changes in lymph flow, there's changes in cerebral spinal fluid flow, there's obvious changes in nerve flow, which we talk about a lot in the chiropractic world. But just because we can't see it doesn't mean it's not changing, right? There's so many, and chiropractors, I think we know this better than any other providers, especially medical doctors. We know how amazingly crafted and coordinated our systems are all at once. And so many reactions, billions of reactions are happening without us even thinking about it. And so when we have misalignments at the CranioCervical Junction, between the brain stem and the spinal column, it controls every function in our body. And so if we're not getting the proper blood flow, the proper cerebral spinal fluid flow, the proper drainage from the brain, we have a lymphatic system that within the last couple of years is really being studied. Something we never even knew about. But it would make sense that people who are in alignment are sleeping better and they feel better because their lymphatic system is able to actually drain because there's not a kink, for lack of a better analogy, in their system. Mm-hmm. And so the upper cervical spine, because it's so close to the brain stem, and you have this tiny little hole out of the base of your head that all of that information has to go through. And then we have the atlas, which is the most freely movable bone in the spine. It can be misaligned in many different ways. Force follows the path of least resistance. Boom. It affects the CranioCervical Junction. You have the whiplash trauma. No matter where you get hit on the body, people necessarily, you think of a football tackle, you hit the shoulder, the side, you don't even hit your head. The camera doesn't zoom in to where you're getting hit in the shoulder. They don't care about that. They zoom into the head and the neck and go, whoa, look at how his head just went from side to side, right? Force follows the path of least resistance, and that is the CranioCervical Junction. And so because there's no bony interlockings of atlas above or below, you don't have a facet, you don't have a disc.
Yeah.
It has the most range of motion. And so it can be misaligned in so many different ways, and it can be misaligned way more severely to the degree, right? Because in order for other vertebrae to become misaligned to the degree that atlas can, they actually almost have to jump a facet where you have a perched facet or something. And then you can have a true subluxation of the rest of the spine. But there's no jumping or perched facets at atlas. It's just straight rotation.
And it locks out, yeah.
Yeah, it's like wringing out a wet towel, you have that torque, you have the dural tension, you just have so much strain on your spine. So when I finished the Diplomat, or while I was in the Diplomat, I met with a neurosurgeon and I was speaking his language because I understood the language of the CranioCervical Junction. And that's what they use in the medical profession. They don't say the upper cervical spine, they say the CranioCervical Junction. So when I talked to him and I talked about cerebral spinal fluid flow and the dural tension, and I was using these terms, he said, you're different. You're different.
Yeah.
But I was speaking on his language and he wanted to talk to me because of that. And so he actually took me to sushi. We had an amazing conversation about what he does and how I could, and we have a great working relationship. He refers to me before he gets a patient under surgery. And he goes, you know what, this dural tension that you're talking about makes 100% sense, because in his words, I cut into some people and their spine is just completely relaxed, super easy, standard, cookie cutter, your textbook spinal surgery. He goes, my toughest, most complex cases that usually don't respond well, what happens when I cut into them, it's like a spring unwinding. So it just goes ping and unwinds. He goes, there is so much tension in that person's spinal column and the dura that it literally just unravels. And he goes, now I got all these moving parts and it's hard. He goes, that is the hardest patient. When I cut in, I know it's not going to be that good.
Wow. I never thought about it from that perspective. That's very interesting.
Yeah. So he gets it. So when I say, let's check them out from a neurological biomechanical perspective, let's reduce that amount of tension as much as we can prior to going into surgery, they are going to have so much better outcomes and maybe even prevent the surgery to begin with, right?
Absolutely.
And so we worked together and we've prevented some surgeries. We've had improved patients' outcomes because they've got under care but still needed a surgery. And so, yeah, it makes total sense.
I wanted to ask you, what were some of your biggest takeaways from the Diplomat program? Because a lot of people, myself, think, oh, it's more learning, it's more school, it's on the weekends, I'm running a busy practice. Were you able to run your practice completely and do the Diplomat? What were some of the big things you took away from the program?
So first off, I had been a year out of practice and I had just jumped into my new practice. So I literally was building a practice from the ground up when I started. I had 0 patients when I started. So if you already have a practice and you have some patients, you're starting off in a more stable position than I was.
Yeah.
To go away for 1 weekend a month, right?
1 weekend a month. That's not bad.
That's not bad. And you can do it. And does it take a hit on your practice? I had to leave and shut down Friday sometime, depending on how far I was flying. I live in a small town, so I never had a single direct flight to anywhere that we went. I always had to have Blair, so that lengthens your travel time. But the value was well worth it. Were there some weekends where I was like, man, that was a lot of information, a lot of learning. Wasn't really what I was looking for. Wasn't the critical thinking piece, but was it necessary? Yes. And did it help my understanding in the grand scheme of thing over the 5 years? Yes. Some of those things, it's just like in practice. You love some things and you wish you didn't have to do others. So from a time perspective, the amount of understanding that you get and the complexity and the neurology and the cerebrospinal fluid flow, and the biomechanics and the understanding of different techniques and how we analyze. When you can start looking at things from a bigger 3D perspective, when you can say, this is how I see it because I've refined my technique and I know exactly how to analyze it from the way I see it. But then you can take that perspective from the way another doc sees it and say, look at this. Did you see this? Right? Did you look at this perspective? And then your critical thinking on how you can help that patient expands tenfold. And it's not overwhelming. It's that critical thinking piece that really accelerates the patient outcomes. So that is first and foremost the most important thing that I got, because for me, it's all about patients getting well and saving lives and helping people live a happier, healthy life. And then the second part is we have to do a better job of educating our community and our colleagues. And the educational piece and the understanding of how to communicate not only with our patients, but sometimes more importantly, how they're going to get to our office, which is by other providers saying, hey, you need to check this technique out. You need to check out this chiropractor. That is a critical piece. So when I came back, that neurosurgeon said, hey, can you present to my group of providers? So I presented on the CCJ, cerebral spinal fluid flow, to about 15 different providers. He introduced me as a neurosurgeon, said, this is Dr. Rachae Bell. She's going to teach you about the CranioCervical Junction and cerebral spinal fluid flow.
Yeah. And that pinched nerve garden hose analogy is not going to work with those people.
Exactly.
Yeah.
So they get it. They get it. They get that when there's a complex case. I just had a primary doctor refer me a patient because she has hot feet. They don't know what the hell's causing the hot feet, right?
Yeah.
But it makes sense that it's neurological. It makes sense that the brain and the body are not communicating. There's something out of balance. And so maybe it could be your nervous system. Maybe it could be the CranioCervical Junction. So they send them over. Try out Dr. Bell.
Beautiful, yeah.
She does something different. She's not your typical chiropractor, and she specializes, and I think she might be able to take tension off of the nervous system and maybe help your body function better. It makes sense, right?
Definitely, yeah.
So the ability to communicate with other providers is hands down. I mean, my mom, this is a funny story, just told me yesterday that she's been working on a patient to come in, a colleague. She's a teacher in a grade school, and she's like trying to get her friend to come in. So her friend's going to a neurosurgeon, ends up Dr. Schuster, who knows me. And Dr. Schuster says, the only chiropractor that you can go to in Spokane is Dr. Bell. So my mom's watching my daughter. I go to pick up. She goes, you got to hear this story.
That's great.
Forever. She went to a neurosurgeon, and the neurosurgeon even told her that she needs to come see you. So
amazing.
It can happen, and we really do need to collaborate and understand and respect what they're doing. I mean, do we want people to get cut on? No, but we have an amazing emergency medical system. And when things happen, like if I break my neck in a car accident, I better believe I'm going to the orthopedic surgeon to see what's going on. And if I can avoid it, I will. But you break your arm, I don't want you walking through my front door. Yeah. So respect of other techniques. I think for me too, even with respect within the chiropractic community, do I think that what I do is the end all be all to every single patient? No. I had a patient come in, I'm like, man, you definitely have something going on with your ankle that I think chiropractic can help you with. But the last time I adjusted an ankle was in chiropractic school. So I'm going to send you to a chiropractor who I know rocks extremities, and he or she's going to take good care of you.
Yes.
So we co-manage.
The patient loves you for that, and they love the other doctor. Yeah.
Exactly. They love us both, and that's no problem. Like, more people need what we have. They're frustrated with going to the doctor, telling them their symptoms, not getting an exam, getting rushed out of there, and being pedal pushed a bunch of different medications because of the symptoms they've been told. They want to know what's wrong and how to help it. They don't want to just cover up symptoms, right? And so we need more chiropractors. We need more helping people get well without the use of drugs and surgery. And so if we can collaborate and respect each other and know that we're all doing amazing care for people, it's going to bring our whole profession to the next level. So even with PT and massage, I mean, I think it's really important for me to focus and be the best at what I do. And my goal is to get patients from all over the world who want to come because we get amazing results and we can help them. But I'm not going to try to be everything to everybody. And so when I know that's outside of my expertise, I refer. Yeah. And I refer them to somebody who is also the best in whatever I'm referring for.
Yeah, definitely. Got to put the ego aside sometimes and let somebody, definitely.
Yeah.
That's great.
Yeah, we can't come from a scarcity mentality, man. So many people need us, and we have to come from a mentality of abundance.
Absolutely. Yeah. Dr. Rachae, where can people find you online and your practice name and everything if they want to schedule an appointment or just find more information about you?
Yeah. So Spokane, our website is www.clearchirospokane.com, ClearChiroSpokane. And that is our website for the practice. You can find all the information pretty much you need on there as far as phone numbers and things. My personal email address, I don't mind sharing. It's the work email is dr.bell@clearchiro.com. So dr.b as in boy, ELL@CLEARCHIRO.com. Our practice number is 509-315-8166. We do have a Facebook page, Clear Chiro Spokane. We have Instagram, the same thing, Clear Chiro Spokane. So you can find us on all those different avenues. We're always trying to be engaged in the community and online and updating all of our stuff. We've got a great team, and we're developing even more in that social media realm. So like us, follow us.
Beautiful.
Learn from us, steal from us. I don't care.
And Dr. Bell, at the end of every episode, I like to ask all my guests, what is one piece of advice that you've really learned from over the years that has really resonated with you that you would like to gift the audience? Could be absolutely anything.
I will give a piece of information first to students. And that piece of information is find a mentor that you can work with. I think we come out of school and trying to run a business, I think it's doing a disservice to your patients trying to juggle all those plates at once. find somebody that you can work with and have a good relationship with, and even think of it being a long-term relationship. It doesn't have to just be an associateship for a couple months and then you go out on your own. I mean, even if you can stay for 3, 5 plus year, 10, like together, we can accomplish so much more. And when you go out on your own, you do reinvent the wheel. And there are things that you shouldn't be reinventing the wheel on all the time. It's silly. So that's my first advice to students, is really have an open mind to being on a team. And then when you're in practice and you do end up on your own, have an open mind to build a team and to take on other students, because we really have to have this mentorship and take other students under our wing to get better results. And I think that's important. Second is for patients. Continually be your own advocate. There are things out there that can and will help you. There are people who have a better understanding and are willing to take the time to understand and learn and analyze and really examine and dive deep into what you've got going on and do their best to help you. And if they can't help you, they'll send you to the next person or collaborate or co-manage or do whatever it takes to do the best they can at accelerating your healing. So patience, and if you're out there and you're struggling, you haven't found any answers, keep diving, keep being your own advocate, keep researching, and really reach out and continue to advocate for yourself, because most of the patients that I see who have had the biggest change in their lifestyle, they came because they kept researching, and that's really important. And we're here to help you.
Beautiful. Well, thank you so much for coming on. Really enjoyed this episode. You were a wealth of knowledge on upper cervical and chiropractic and just overall well-being. So thank you so much for joining us.
Thank you so much, Doc.
Thank you, everyone, for listening. If you enjoy the podcast, subscribe, give us 5 stars, and leave a review. It really helps boost the podcast and spread the good word. My chiropractic practice is located in West Orange, New Jersey, at Montclair Upper Cervical Chiropractic. You can also find us on Facebook at Montclair Upper Cervical Chiropractic. All of my information is on my website at drkevinpecca.com, drkevinpecca.com. You can subscribe to my YouTube channel at Dr. Kevin Pecca for podcast episodes, patient testimonials, and educational videos. I have daily affirmations and inspirational quotes on Instagram at Easel Affirmations, EASEL Affirmations. And if you have any questions, feel free to email me at drkevinpecca@gmail.com, drkevinpecca@gmail.com. Thank you, everyone, and have a great day. Cheers.